Ladies and gentlemen, there's a blame everyone casts in the same direction. Everything that happens to us is because of the thyroid. Oh, I'm nervous because I have thyroid problems. I gained weight. Clearly, I have thyroid issues. So naturally, we went to the doctor with our thyroid. Dr. Ovidio Penesh, a doctor of medical sciences, will ask him if it's true that everything that happens to us in this life is like a horoscope because of this old retrograde Mercury.
Mercury retrograde. Yeah, you know, the thyroid is always to blame, and we'll find ourselves getting scared and start to believe that we have other health problems, other diseases. And in fact, we will see that we are indeed right when we place the blame on the thyroid. Why is that? Because the thyroid, as you know, we've talked about this before, is a gland that commands our entire organism. Of course, in turn, it is also influenced by our brain through a gland that controls all hormones. But the thyroid, you will see, plays a role in all of our organs.
Their behavior varies depending on the season, because now I'm noticing a certain incidence.
Yes, autumn is beginning now. We're starting to experience all the symptoms that if during springtime we were able to compensate for them because other hormones were present at different levels, and in some form or another, we didn't really start to feel unwell. In autumn, that's when all the problems really start, because all these phenomena begin where our glands become less productive in producing hormones, so they no longer produce the same amount. You'll also notice that in springtime generally, the production of thyroid hormones is stimulated and increases, and problems related to their excess begin to appear. That's not good. So it's all about balance, not too much, not too little.
What is it you have to do? Let's try to understand the mechanism.
As I was saying, as it is thyroid gland, which is shaped like a butterfly and is positioned here at the base of your neck, you can even see it. It transmits hormones that influence the metabolism of all cells in the body. It influences the heart, it influences the liver, it influences the intestines.
Essentially, you will find that this is present in all our problems, and that is precisely why, very frequently, we mistakenly believe that we are suffering from an ailment of a different organ or another kind of issue, such as, for instance, the heart. We often think we are afflicted with heart disease.
Yes, when we start to experience palpitations, I get extra systoles. I feel my heart beating right at the base of my throat, or even in my throat itself, and I can hear my heartbeat in my ears, or the rushing of my blood vessels. I have elevated blood pressure. Of course, it's possible that I'm also eating incorrectly, and it's certainly possible that I have higher cholesterol, or simply high cholesterol.
It's simply and solely because I am eating improperly.
I might be on a diet. I eat quite well. I exercise, and still my cholesterol is high, or my blood pressure stays high. I go to the cardiologist and take blood pressure medication. But have I ever thought that maybe my thyroid gland, this culprit, has started secreting more hormones? What does it do?
Your heart rate will begin to increase. You'll start to feel these palpitations all caused by these specific hormones.
When there are too many or too few?
When there are too many. Similarly, the blood vessels begin to contract, causing the pressure in the system to rise, leading to hypertension, when, on the other hand, there's too little. I feel like I have problems with my peripheral circulation. How many of you have told me that my hands are cold, my feet are cold? I always feel cold. My neighbor from the building says I have circulation problems. Have you considered that an underactive thyroid, a thyroid that doesn't produce enough in that optimal range that we truly need, might be the reason why my extremities are cold and not at all a vascular issue?
Once again, people are complaining about their nerve problems. Sir, I get so agitated and swish from one state to another. I have these mood swings that I just cannot explain. Could it also be coming from the thyroid gland?
Thyroid, yes, the brain is also affected by this thyroid's activity, and you'll find yourself taking too many antidepressants, going to a psychologist, then to a psychiatrist, because you're suffering from depression, because nothing pleases you anymore, and you've started not to be your old self.
A tremor of the hands.
For example, Chad, these things are certainly caused by an insufficiency of one thyroid hormone or both thyroid hormones. So when the gland isn't working properly, you can have these manifestations. Or conversely, when an excess of thyroid hormones gives you a state of agitation, you're very nervous, you're very agitated.
Ceratatious, start not sleeping properly, and you'll see like it's a vicious cycle. Or insomnia causes thyroid problems, and then my thyroid problems cause insomnia. Or you might think you have neurological issues and go to a neurologist because you say, doctor, I've started to get Alzheimer's, and I've started to have para to forget. It's as if my mind isn't as sharp, and I don't recall things like I used to. And at the office, I can't concentrate with the same ease anymore. And I feel very sleepy. And you'll find that this is also due to your thyroid. A thyroid that isn't functioning correctly, and as you yourself said, it can also cause a whole range of peripheral symptoms. You'll start to experience numbness in your fingers, the fingers of your hands, numbness in your shoulders, and so on and so forth.
You gain or lose weight from your thyroid. It depends on how it works. So that's how it is. It's not a myth.
You might attempt to lose weight only to find that you don't succeed. It is always absolutely necessary to regulate your thyroid hormones or to ensure that your thyroid function is properly adjusted and balanced so that you can either gain weight effectively or successfully lose the weight you desire. You will never truly manage to make a significant modification to your body's overall structure and its fat content if your thyroid function is not operating optimally. The liver. You might say you have a liver condition because you wake up each morning feeling extremely tired. You tire out so easily, you get tired. Just as you've heard and as we've talked about, that it might be a problem, I have hepatitis. Why? Because I don't have the energy to do anything anymore. I can't even do sports, no physical exercises. Everything feels so difficult, I am nauseated, and sometimes I completely lose my appetite. You'll soon discover that these various phenomena are actually all due to your thyroid gland. As for my kidneys, I will mistakenly believe that I have serious renal issues. Why do I wake up with swollen hands, swollen feet, a swollen face, and swollen eyelids? You'll see that sometimes we also check the tongue if we open our mouth. Your tongue shows teeth marks, and then you say, I have edema, I've accumulated water, water elimination isn't functioning well, and then I go to check my kidneys, when in fact I should also be checking my thyroid because it significantly influences renal function and also how water is retained within the body's tissues. I believe I'm starting to come down with a cold. Why are my bones aching so much? My muscles, I'm having chills, my body is finally trembling, my joints are hurting, yes, all of my joints, and I have the sensation that I have a joint problem or perhaps a cold or the flu is beginning with my hands feeling cold, and then again these widespread chills when in fact I will realize that it's still my thyroid behind all these manifestations. You think you're pregnant, that your period isn't coming, your menstruation isn't arriving on time. You begin taking pregnancy tests and you consistently find that they're coming back negative. It's important to consider that your thyroid gland also plays a significant role in influencing this reproductive system, your ovarian function, and the overall regularity of your menstrual cycles. And of course, there are times when you might experience periods that are either extremely heavy or very irregular. When you encounter such symptoms, it's crucial to promptly go and have your thyroid function thoroughly checked. Your hair is falling out, your nails are brittle, your skin is very dry. Instead of going to the dermatologist and wasting time on a whole range of lotions, trying all sorts of shampoos, stimulants, and various nail solutions, first check your thyroid, and then, if its function is normal, you can look elsewhere for the cause. What should we do when we experience these symptoms? Simple things. You measure your temperature every single morning. If your temperature is too low, you'll notice that your gland isn't functioning as it should. You measure your pulse, you count how many beats you have per minute, too low for a temperature, 5 point something, so not a normal temperature. Yes, in the morning, when you first wake up before you've eaten anything, and then you will clearly see that your metabolism is much lower, and it's clear your thyroid is also functioning. Perhaps that is the reason why your body temperature is low. So you also know that it affects your heart's rhythm. I should not check your pulse. If it's consistently 100 or even more, meaning an elevated pulse, and you're experiencing all these symptoms, check your gland, go to the doctor, and get your periodic tests done. Or you have a very low pulse, and you're certainly not a performance athlete for your heart to be balanced at such a low rate. You should go and get your thyroid rechecked again before you even begin to undergo the required investigations every 6 months. it is advisable that in addition to the tests you are already conducting, you also perform this check of the thyroid-stimulating hormone, which consequently influences the levels of thyroid hormones, but also the pituitary hormone that regulates both the thyroid hormone production and the overall thyroid gland secretion. So TSH, FT3, FT4. No substitution is needed, and those who have a disease and have this gland removed need to administer a specific dose of thyroid hormone every single day. How do you keep it healthy? This is what we are truly interested in. Yes, you might be experiencing thyroid issues. To prevent them, you must be aware of certain things. There are factors that influence the thyroid gland. Habits, and does it sound familiar? Drinking water from plastic. Those BPAs in this plastic have been clearly proven in many studies to affect your thyroid gland, blocking it. Does this device sound familiar to you, the one you play with day in, day out, holding it right next to your brain and ear? It has been proven that extensive use of cell phones also deregulates the thyroid gland. Broccoli, which is very healthy and good, produces positive effects if you eat it raw or insufficiently cooked and white. A little, boiled but cooked, never raw. Because even though it's very good raw, people who have thyroid problems could potentially experience even greater difficulties.
Broccoli can irritate your thyroid.
There are compounds in broccoli that can lead to thyroid insufficiency. These compounds block the release of your thyroid hormone. Just wash it briefly in plain tap water with Oreca Pack and you're all set. Sleep. I was mentioning that if you don't get enough sleep, you'll start to have restless nights and won't go to bed at regular hours. You start producing too much adrenal hormone here, adrenal hormones. But cortisol will poorly affect thyroid function, and automatically, if your sleep is disrupted, your thyroid function is disrupted, and vice versa. You think you can use any kind of soap, any kind of shower gel, and that nothing happens when you use them on your skin. Studies have shown that many substances in these soaps and washing products and non-biodetergents negatively affect the thyroid gland. Green tea, which is otherwise good for those with thyroid problems, is not recommended. Switch to a little coffee or some black tea which don't have these issues, especially for children.
Nuts, as an example.
Those with iodine, but they must first know to check their thyroid function, because sometimes excess iodine in certain situations is not good. Yes, the paste from flowers. So especially in children, that is very dangerous. It disrupts the thyroid gland, and children with thyroid disorders who stopped growing have been observed. Their growth was stunted due to their excessive use. Not to mention cigarettes. It's clear they negatively affect everything in our bodies, but they also play a role in this thyroid area.
One more question. It says iodized salt in big letters. What do I do?
We only use it when we have an iodine deficiency, right? And when our doctor or the endocrinologist has told us, use this salt and use this specific amount. At that point, they will also prescribe you supplements for this. To ensure you maintain, especially during these transition periods from autumn to winter, a healthy thyroid function, you need to include in your diet foods that will help balance this gland: B12, selenium, and vitamin D. Do remember that mackerel, milk, mushrooms, and whole eggs also contain this vitamin. I'm also reminding you about Brazil nuts, crustaceans, and tuna. You really should include these in your diet, especially during this autumn transition period. Salmon, sardines, and a portion of red meat twice a week, so that you can ensure your gland is functioning exactly as it should be.
And if that's not the case, we'll go and do some testing.
I will do the tests anyway. First and foremost, consider your thyroid. Ask for blood tests if they're not done during your regular checkup, specifically TSH and the free fractions of thyroid hormones, so you can see your status and what needs to be done. Thank you very much, doctor.
Last but not least, we must also extend our gratitude to our friends at Eurodidactica for these wonderful chats. Thank you very much indeed. And we'll see you again next time with more helpful advice from Dr. Ovidiu Peneș.